How did you sleep last night? How are you feeling? Are you energetic and really excited about the work week? If not, you may want to know about BioTE. Marilyn Cannon, welcome back to the show.
Thank you.
All right, now, before we talk about BioTE and why the Physician Center for Beauty decided to get into that industry, that is my question.
Yeah.
It's a perfect marriage, isn't it?
It's a perfect marriage. For 12 years, we've helped people look better on the outside, but we also recognize that aging starts on, within, and so that begins with hormones. And so our goal is to really help our patients age healthier as well as happier and younger from the outside.
Yeah, I think it's something we should talk about because you may not be feeling so energetic or perhaps not sleeping well. These are some of the symptoms, but this is natural.
Yes.
But now what BioTE is all about is being proactive instead of waiting and waiting for perhaps degenerative diseases to take control of your life.
Exactly.
To really be proactive and do something about it, right?
Exactly. Yes, BioTE, of course, we're partnered with BioTE Medical, who's a leader in bioidentical hormone replacement therapy. And it's a leader for a number of reasons. It's a plant-based non-synthetic hormone. It's identical match to our human hormones. It's in pellet form, which is the right form. It's inserted painlessly underneath the surface of the skin. It's smaller than a grain of rice. It releases hormones that are identical to our own human hormones, estrogen, testosterone, and it's released directly in the bloodstream, just like our ovaries and testes release it. And it releases it 24 hours a day, 7 days a week for several months at a time, so you don't have to think about it. So it's the right hormone. It's bioidentical, like exact match to our own human hormones. It's the right dosing. It's based on a comprehensive blood panel, as well as symptoms, as well as health history, and we basically follow through with every patient to ensure that their hormones are optimized, and our goal is to optimize to levels where you're in your 20s, where we were in our 20s and 30s. That's when we felt our best. That's when we were our healthiest. And so bioidentical hormone replacement therapy really is the best option. It's been around since the 1930s. There's lots of research and data that supports the safety and the efficacy of this form of hormone replacement therapy. And as most people know, most people are very familiar with synthetic hormones, and that's widely prescribed by our obstetrician, gynecologists, our endocrinologists, internal doctors. And that basically our synthetic drugs are Band-Aids. They treat symptoms of low hormone production, but they're not really getting to the root cause of why we're having those symptoms. What we're doing is actually restoring hormones with a bioidentical hormone that exactly matches our own human hormones. There's no adverse side effects associated with this, and we can use this forever. As long as you want to feel better, as long as you want to enhance your longevity and protect against age-related disease, then this is the right hormone, the right treatment for you.
So as you can tell, if you've been thinking about hormone therapy, this is the route to go here with BioTE hormone therapy. I want to talk a little bit about the way is it administered.
Sure.
Because there's other companies, other facilities that do the injectables.
Yes.
This is a little bit different when you talk about pellet. Tell us a little bit more about the pellets. Again, you said they're really small.
Yeah, they're very small. They're smaller than a grain of rice, and they're inserted painlessly without stitches, just a steri-strip underneath the surface of the skin. It's in an area that no one sees. There's, you're not aware that it's there. It might be tender for a couple of days after being inserted, but really you're not going to know it's there once it's healed. But it is absolutely the optimal way to actually restore your hormonal balance with this type of hormone, because it's released 24 hours a day, 7 days a week, directly into the bloodstream, just like nature intended, just like your ovaries and your testes and your adrenal glands release these hormones. That's what this pellet is doing. It is, like I said, it's the only true bioidentical. It's plant-based, non-synthetic. The components of our pellets are FDA approved. The processing of the pellets are FDA monitored, and so we're assured of the accuracy of the dosing, because every prescription is different. It's unique to each individual. It's not a one-size-fits-all. And it's also, we're assured of the purity of the hormones. It's nothing but pure hormone that exactly matches our human hormones. There's nothing else in it.
All right, I like the fact that it's time released.
Yes.
And if you're taking injectables, you may feel good for a couple of days, and then as the amount or the dosage decreases, you start feeling, you go downhill a little bit.
Yes.
So this is a nice even, like your body produces.
Right, this is exactly right. This is 24 hours a day, 7 days a week, just like nature intended. All of the other forms, whether it's a natural or whether it's a synthetic, might be administered orally, topically, in a patch, or in a cream. And all of those are not ideal ways to administer hormones. I mean, I'm not saying it's a bad way to do it, but it's not the best way to do it. So, topical creams can be transferred to pets and children. It can be toxic to them. Also, you're not assured of the dosing you're getting. I mean, you have a prescription for that, but you don't know how much your body's actually absorbing, and it has to actually go through different processes. It has to go through the liver. If you take oral medication for your hormones, it has to go through the digestive system. So you're not not quite sure how much of the hormone you're getting into the system. Whereas with the pellet, we know exactly what you're getting. It's a prescription that's based on your labs, it's based on your symptoms as well as your health history, and it's released directly in the bloodstream, so there's no interference with other body processes.
You can tell that Marilyn Cannon has done her research. If you have a question, 571-5263. Marilyn, you brought a book with you, and if someone comes in for a consultation, you recommend this. Age Healthier, Live Happier. Tell me a little bit about this book, and it really does relate to BioTE and hormone therapy,
Well,
right?
BioTE Medical, again, is a company that we're partnered with. It's they're the leader in bioidentical hormone replacement therapy. Dr. Gary Donovitz, who's the author of this book, is the CEO of BioTE Medical. He's a board-certified obstetrician gynecologist. His passion is to, he didn't learn about pellet therapy or bioidentical hormone therapy in school. He learned this by happenstance when one of his patients, who he couldn't help with synthetic hormones, went and sought out a doctor who was offering pellet therapy, and so she had remarkable results. And when he saw her again for a routine checkup, he couldn't believe how well she was doing. That's when it opened the door for him to learn about this, and he recognized that it had been around since the 1930s. Tons of research supports the safety and the efficacy of it. It just wasn't on the forefront because it's not owned by pharmaceutical companies, because you can't patent a plant-based non-synthetic substance. So anyway, so it's becoming, but his passion is to really spread this around the country. We're partnered with, we're part of a network of over 1,500 medical practices across the country, which include urologists, OBGYNs, internal docs, all docs and practices like ours who've become enlightened on a way to really help patients age healthier and happier at the root of why we're experiencing symptoms as we age.
So if you're watching the show and perhaps you've been a little bit apprehensive because you thought, well, there are too many question marks, I'm not quite sure, the answer may be BioTE hormone therapy.
Yes.
I want to ask you, and I often do this because I think this is important, what kind of reaction are you getting from your clients? And you happen to be someone who uses BioTE,
Oh,
right?
absolutely. I'm the reason why I really sought this company out, because I'm 61. I was experiencing all the symptoms of low hormone production, and I was miserable. I'd lost my drive for life, my zest and drive for life. I was feeling exhausted at the end of the day. Lost my interest in the things I love to do, like riding horses, and just didn't feel like I could, keep up with my schedule. My libido had diminished greatly. Physically, I wasn't, I work out all the time, but I was losing muscle tone. I was gaining more fat. So I really felt like, this was an option. This is certainly something I wanted to look into, but I also felt like if it was something I'm interested in, that my patients, our patients at Physician Center for Beauty, would benefit greatly from as well. Because again, we address the outside of aging really well with all of our services under the direction of Dr. Sean McGuire, but aging starts within, and so that's what we want to do, is help them, the whole body.
So for a consultation, you're going to waive the consultation fee?
Yes.
Okay, so waive the consultation fee if you mention the show, waive 3 listens, and you can go in for a consultation. Then you may decide to go in the direction of BioTE hormone therapy. There's the information on the screen. We certainly recommend that you give them a shot. And these guys are professionals, optimal aging specialist Marilyn Cannon, of course, Dr. Sean McGuire, and you can be part of the team. Feel better today as you get ready for your work week. Give them a call at the Physician Center for Beauty.